Hello and welcome to our latest edition of Inside CRCAIH. I'm your host, Melissa Buffalo, and today we have with us Wyatt Pickner. Hi, Wyatt.
Hi.
So, as many of you know, we've been out in the communities doing interviews with our tribal partners as well as some of our pilot grantees, and today we thought we would bring it back to Sanford Research. As many of you may or may not know, this is Wyatt's last week with Sanford as he is pursuing his graduate career and leaving for the University of Washington next week. So, just wanted to get some time in with Wyatt and get some feedback from him. So, Wyatt, tell us a little bit how you became involved with CRCAIH.
So I participated in an internship the summer of 2013, and I was placed at Sanford Research with Dr. Susan Pumala working on her emergency department study. And then after the internship, I was able to continue working as a permanent employee.
Okay, and kind of tell us your role over the last few years.
Over the last few years, I've continued to work as the coordinator for the emergency department study, which, we're working to improve care for children in the ED, and then also providing education to parents and caregivers on how to care for a sick or injured child. I've also been a member of the Methodology Core, helping to provide assistance to tribal partners based on what their needs are. So doing things like survey development, helping with community health assessments, training on focus groups and qualitative research methods, those kind of things.
Cool. So, as I mentioned, you are going to graduate school. So, and you're going for a master's in public health, correct?
Correct.
So, can you kind of share some of your career and personal goals that you have?
Yeah. So, in general, I would really like to continue working with Native populations on improving the health of their communities. I guess more specifically, my interest in research actually started when several people in my family were diagnosed with some serious health issues, specifically cancer. And I just remember going through that experience and being incredibly frustrated that there was nothing that I could do to help them at that time. And so I recognized that I had a passion to help others with health issues that they were experiencing, and I really wanted to be able to prevent them from even having to go through that experience in the first place. And so that's why I started looking more into public health, because it's more about disease and disease prevention, basically promoting healthy lifestyles. So my hope is to help Native communities and families not have to get to the point of going through kind of those difficult times like that, especially if it's the people are very young, because that can be very difficult to have a short time.
Awesome. I think that is awesome, not only for your family but for community in general across Indian country. So I wish you the best of luck. And I do have one last question. You want to share any of your most memorable favorite times of CRCAIH and some of the trips you've had?
Yes. So there have been many, many really good memories that I've had during my time here and my involvement within CRCAIH. But I guess what I've really enjoyed the most about CRCAIH is within the name, and that's collaborative. And so what I mean by that is that everyone that we work with, especially the tribes, most importantly the tribes, are very involved in all of the decisions that are made, the things that are happening and going on in their community. So this isn't a project or anything where someone's coming into the community and saying, this is what we're going to do, this is how we're going to do it. It's more asking the tribes and saying, what do you guys want to do? What do you think is most important? What's a priority for you? And how can we help you get there? And so it's just really nice, because I guess the way that I look at it is it's kind of embracing the sovereignty of those tribes and kind of upholding that. So the other big thing is sustainability. And so, just because CRCA may not always be something there in a tribe, that infrastructure is still there. So regardless of anything else that happens, they still have the tools and resources and the training to continue doing that work.
Awesome. I know you've been instrumental in helping that, and I think I speak on behalf of everyone at CRCA that you're going to be missed. And with that, we wish you the best of luck, and we've been so fortunate to have you on our team. So with that, is there anything you would like to say?
Yeah, I mean, I definitely just want to say, give a big thank you to everyone, all the tribal partners, all those that I've worked with on stuff with CRCA. It's been a really, really great and amazing experience. I've learned a lot from everyone, and will definitely, take the things that I have learned with me throughout my rest of my educational career and into my professional career as well. So thank you very much.
Awesome. And with that, have a great day, everybody. Bye.